Hi, Mr. Rowe. How are you today?
Good. How are
My
you?
name is Cara Gilison. I'm an occupational therapy student from the University of St. Augustine. After reading your chart today, I see that you have a left glenohumeral subluxation secondary to a hemiparesis after experiencing a recent stroke. Is this correct?
Correct.
Okay. What is your pain like today out of a 10?
7.
What is your pain at its worst?
8.
And what is your pain at its best out of a 10?
5.
What are you currently having difficulties doing?
Washing my hair, and I like to garden. I'm
Okay.
having trouble gardening.
Okay, do you live with a spouse or have any
I
children?
do. I have a wife.
Okay. What are your goals in therapy?
Get back to my daily activities, gardening.
Okay. I'm going to be doing an assessment on your skin, so I'm just going to take a look at your skin. I see you have no hair, but with the modality that we're going to be using today, if you do have hair, we would be using a clipper to clip it back, but you'll be okay. I'm going to start with a skin sensation test. So I'm going to have you keep your eyes open, and I just want you to tell me if you feel the same on each side.
Yeah.
Okay, so go ahead and close your eyes. I'm going to touch a side. You tell me if it's left or right.
Left. Right. Right. Left. Left.
Okay, you can open your eyes now. Are you currently taking any medications?
It's just a mash one.
Okay. Can you raise your left arm for me?
Just a little bit.
Okay. And what year is it?
2017.
Okay. And where are you right now?
In your office?
Okay. Do you have a pacemaker?
No.
Do you have any hyper or hyposensitivities?
No.
Do you have cancer?
No.
Do you have any infections?
No.
Do you have any skin conditions such as eczema, psoriasis, dermatitis?
No.
Do you have a PDD?
No.
Do you have an ICD?
No.
Do you have a phrenic nerve stimulator or a bladder stimulator?
No.
Okay. So for this modality that I'm going to be choosing today, will not place the electrodes over thoracic region or the cortoid sinus. I will not be using it on pregnant women or near diathermy devices. Over any areas of pathology it will be placed on, or over or near superficial metal pins, plates, or hardware. You don't have any of that in that left shoulder. Okay, so what I'm going to be using today is something called NMES. It's called neuromuscular electrical stimulation. Today on that left shoulder that has the subluxation for 30 minutes. This is an adjunctive method to assist you with performing your daily tasks. When I place the electrodes on your left shoulder, you should expect to feel strong sensation, but it should be comfortable tingling under the electrodes with some muscle contraction, okay? So by using this neuromuscular electrical stimulation, it will help decrease your pain that you're having with in your left shoulder. It's going to facilitate active shoulder movement. It's going to decrease the shoulder subluxation and decrease dependence on wearing a sling and improve overall independence with completing your daily tasks, such as you said, washing your hair, brushing your teeth, or gardening. Also, it's going to assist with muscle contraction during active and functional movement. It will help with functional muscle movement, maintaining proper alignment of the humeral head in the glenohumeral joint, pain, and muscle tone. During this the neuromuscular electrical stimulation that I'm going to use on you today, I will have you work on active range of motion. So I'm going to have you try to move the arm. I'm going to have you do some muscle contractions with the electrical stimulation and some shoulder shrugs. So you'll be doing this kind of movement. And maybe some towel slides as well in different planes. So after the treatment is complete, I will have you work on a simulated task of washing your hair and emptying potting soil into small pots in preparation for gardening. would this be okay to work on today?
Yeah.
Okay. So I'm gonna position your left shoulder. So if you can bring this one down. So we're gonna be putting this arm up here. So I'm going to be cleaning off your shoulder with some alcohol. Just kind of prep it. I'm going to kind of let it dry there. Okay, so I'm going to be placing these 4 electrodes on you now. One's going to be on your anterior delt. One's going to be on your posterior deltoid. One is going to be, I'm going to be placing it on your supraspinatus muscle, and your another deltoid on your infraspinatus muscle. So I'm going to be hooking this up. I'm going to set the waveform for symmetrical due to the large muscle group here area to work on. So I'm just going to be plugging this in. I'm going to set the waveform to symmetrical. You doing okay so far?
Mm-hmm.
Okay, so I'm going to be setting the waveform for symmetrical, and then I'm going to be setting the frequency for 30 pps, and then I'm going to set the pulse width at 300 microseconds, and then we're going to do a duty cycle. So that's going to be an on and off. So there's going to be 1 second on, where you're going to do a contraction, and there's going to be 1 second off. And then there's going to be a ramp up and down for 3 seconds. I'm going to set the cycling mode for Siconius, and I'm going to start increasing the intensity here. So I'm going to start hitting it. So I want you to start kind of contracting the muscle, and let me know when you start feeling it. You know, a full muscle contraction.
Mm-hmm.
Okay. So I'm going to give you this bell on your right side. So just in case you feel uncomfortable and you need something, you can ring that on your right side. Please also inform me when you're having any discomfort during the treatment and experience any sensation other than the expected sensation.
Okay.
So I'm going to hit the start, and we're going to start, and I want you to start doing some muscle contractions and some shoulder shrugs, okay? Slowly, okay. Are you doing okay?
Yeah.
Okay, so now that 30 minutes is over, and how is your pain now?
It's good.
Out of a 10?
4.
Okay, so I'm going to remove these electrodes from you. And I'm just going to kind of inspect the skin. Everything looks good. There's a little bit of redness here, but that's from the current of the electrodes, and that will disappear in a little while, and that's a normal response. So now we're going to begin working on that simulation of washing your hair and putting the soil in the pots. Also, I will be teaching you some compensatory strategies to perform your daily tasks due to your shoulder subluxation. I also will be giving you this handout today that you can take home on the proper procedure for using neuromuscular electrical stimulation at home on your left shoulder to gauge and functional tasks. Do you have any questions today?
No, that sounds good.
Okay, thank you.
Thank you.